Several employees and medical staff of the Penang Adventist Hospital have voiced out mistreatment that they have experienced from the public after 3 positive COVID-19 cases were detected in the hospital. The hospital's outpatient unit supervisor, Leong Chiu Yan, said her nurse's landlord would not let her into the house after there was a case recorded at the hospital.
The house owner don't allow her to enter the house.
She rented a room?
Yes, she rented the room. So she is staying with the house owner. So she seek help from us lah. So what we can do for her is we let her go proceed with a COVID test to prove that she's clear, and also she is not a direct contact of the patient, but they still think like she is a COVID contact. And also we have staff that on that immediate night that we have the press release, immediately the school start to message the parents or my staff saying that, okay, you please don't send your child to our school.
Last week, 57 nurses and 2 doctors from the hospital were sent into quarantine after coming in direct contact with a patient from Kulim, Kedah who sought treatment there. On social media, a photograph of a notice at an apartment block in Pulau Tikus has gone viral. The notice states that staff of the hospital living there must show their COVID-19 test reports to the apartment management committee as a preventative measure. Many of the hospital's employees got calls from their children's schools or kindergartens telling them to take their kids home at once. Penang Adventist Assistant Administration Manager Lau Poh Ling, who does not work at hospital wards, experienced the same treatment.
So Sunday, I asked the principal, would you accept my son to go to the kindy? Then she replied, she said, as long as your son is fit to go to school. What do you mean by fit? If fit, that means I need to get a doctor's letter. Because right now, if let's say you need to get a doctor's letter, you need to get antigen test or PCR test. I don't want my son to go through that kind of trauma also, because it's not comfortable, because I did that before, so it's not comfortable. Yeah.
Her 6-year-old daughter was required to quarantine for 2 weeks. The hospital's store clerk, K. Christopher, said he at first objected to being told to keep his daughter away from kindergarten, but then he became worried that she would be isolated and the other kids might tease her.
Yeah, and then after that, the message came from my daughter's teacher. Said that are you in quarantine? I say no, you are not contacted.
The teacher herself or himself message you?
Yeah, so I think if the best way is you quarantine your daughter. I say, nak masuk akal mah, because I never been quarantined. Why must my daughter quarantine?
Yeah.
Unable to stand the criticisms towards the hospital staff, pharmacist Daniel Luah expressed her dissatisfaction on social media, and her post has since gone viral. Luah said her family members were forbidden to go to work because she worked in the hospital.
But personally, I also received a lot of text messages from people spreading inaccurate information, which was quite frustrating because it's causing fear in people.
Right.
And also people are judging Adventists as we are the virus carrier in a way. So something that sort of inspired me to write the post on Facebook.
Occupational health expert Dr. Diki Ng said the health literacy of the community can be improved.
I feel that the health literacy of the community can be improved, and we really appreciate media Star come to help to raise the health literacy of the community, because people need to understand how to take care of their health better by responding appropriately. Because if they are fearful, if they become, it can develop into anxiety and some other psychological problem. Having a proper understanding of the situation of the health issue and how to react appropriately.
He said the hospital are contacting their staff in quarantine daily to report if they are experiencing COVID-19 symptoms and their temperature reading.